Okay, so let me read this for you and explain it. So this is a 3-year-old child has cyanosis. Okay, very interesting finding. We talk a lot about cyanosis and why it happens. I'll explain that. Clubbing, squats after playing. So okay, so you are the cardiologist and you would have done an echo. So echo is showing you right ventricular hypertrophy, overriding of aorta, a VSD, which is a ventricular septal defect, and a pulmonic stenosis. So they've given us 4 findings. I think this becomes a very easy question, but and you already in your mind are you figured out the diagnosis of this child. Okay, but let's see what is the question they've asked us here. So the question asked us here is, what is the most important determinant of severity? So severity of this disease. So taking a step back, have we figured out what the child has? What's the diagnosis? So if you see 4 findings here, so clinical is cyanosis, okay? And this is a 3-year-old, so something happening very early on in life, okay? Right ventricular hypertrophy, overriding aorta, VSD, and pulmonic stenosis. So 4 findings. This is, if you know it, this is TOF, tetralogy of Fallows, okay, or TOF, TOF. Okay, so what is the most important determinant of severity? So let's look at the options: degree of right ventricular hypertrophy, size of ventricular septal defect, degree of pulmonic stenosis, location of overriding aorta, and amount of left atrial dilation. So all the top 4 choices, they do happen here in TOF, but the question asking us is, what is the most important determinant of severity of this, okay, if this condition or TOF. So let's look at the answers. So correct answer is pulmonic stenosis. I'll explain it in the next few slides, okay? So pulmonic stenosis is the most important determinant of severity of TOF, okay? And let's discuss more about this now. So this is again something that you learn, what are the right to left shunts, what are the left to right shunts. Okay, so right to left shunts will cause early cyanosis or blue babies, okay, or simply called cyanosis. So one concept before we get into more details. So cyanosis, simple concept would be, why would the baby turn blue? Okay, simple concept. Keep in mind, the baby will turn blue if there is mixing of deoxygenated blood with the oxygenated. For that to happen, blood should flow from right heart to the left heart. So there is an opening, okay, from between the left and the right heart. See, right to left shunt, left to right shunt. It's simply an opening between the two sides of the heart. But right to left shunt means the situation has become so that the blood is now flowing from right to left. Now you would say usually the pressure is more on the left side and the pressure is lesser on the right side in the heart. Agreed, yes. But in all the right to left shunt, the situation has somehow arisen, okay, because of some structural defects. We'll talk about them, okay, so that the blood is now flowing from right to left. When that happens, there will be mixing of deoxygenated with oxygenated blood, and that is when you find this clinical picture of cyanosis. This is the clinical finding, cyanosis. So what does cyanosis tell you? Blood from the deoxygenated side of the circulation, if it is heart, you can say right side of the heart going to the left side of the heart. Okay, makes sense? This is good. So what are the 5 T's or the mnemonic to learn what are the diseases that cause this right to left shunting or the cyanotic or the terrible T's, or all the diseases where all these conditions where the baby would turn blue or cyanosis. Okay, so these are the 5 T's or the terrible T's, you can, if you like that mnemonic. So truncus arteriosus, then we have transposition, then we have tricuspid atresia. Our favorite one is tetralogy of Fallows. So tetra is, of course, 4 features, right? We saw the 4 features mentioned in the question. And then we have TAP VR. So this is 5 letters in the name, and we'll talk about the features later, okay? So let's focus on tetralogy of Fallows, but let's also review what are the left to right shunts? So left to right shunt would mean blood is flowing from the left side of the circulation, which is already the oxygenated side, to the right side. Would that lead to cyanosis? That would not lead to cyanosis. Okay. But you notice what they've said here, cyanosis may occur years later. So this is a situation, now listen carefully, where blood has been going from the left side of the circulation, or let's say left side of the heart, to the right side of the heart. So continuously there has been more blood going to the right side of the heart. Where is the right side of the heart or right ventricle pumping that blood to? Now there is extra blood. Where is that extra blood going to? Right ventricle blood is, being pumped out to the lungs, isn't it? So that means over many years, like 10, 15 years or 20 years, there has been more blood going to the lungs. If that is the situation, eventually what happens is structural changes start appearing in the lung vessels. Okay, structural changes means the blood vessels start thickening, and sort of that creates constriction in the blood vessels. What do you think is going to happen when the lung vessels start changing structurally because of all this chronic increased blood flow going to the lungs over many years? Okay, the pressure starts rising in the lungs. What do we call that situation now when pressure starts to rise in the lung vessels specifically? What do we call it? It's like hypertension is developing, isn't it? Pulmonary hypertension would have developed. When pulmonary hypertension develops in this person who has had a left to right shunt over many years, what will happen? Now the pressure on the right side, okay, may get more, okay, increase and may become more than the left side of the heart. If pressure increases and it becomes more than the left side of the heart and there is an opening, let's say a VSD, would the blood flow now reverse from the right heart to the left? In this child who started off with left to right shunt, adult, it becomes a right to left. What is one feature that we just discussed? Whenever you have a right to left shunt, you with me? Okay, whenever you have a right to left shunt, what happens? Deoxygenated blood is going into the systemic circulation, in the body circulation. What will happen? Cyanosis. So there would be questions which will say, when the child was born, the baby did not turn blue, but adult is turning blue. So this adult has turning blue because of the reversal of shunt, and we call this as Eisenmenger syndrome. Okay, we'll talk about that too in the next few slides. Okay. So I think this is good. So left to right shunts, what are the three important things you should learn? And in order of frequency or order of, how common these defects are. So it's VSD more than ASD and PDA. All of these are with the Ds, VSD, ASD, PDA. That's one way of learning it. One more thing I would want to tell you here. Of course, it says that VSD more common than ASD, more common than PDA. Agreed. But VSD, isolated VSD, is the overall most common congenital heart disease. Its frequency is overall frequency out of all diseases, all congenital heart diseases, the overall frequency is close to 40 to 45%. So it's the most common overall congenital heart condition. What I said is isolated VSD. Now VSD does appear in TOF also, tetralogy of Fallot also. One of the tetra of the four features is a VSD. Okay, so VSD as a TOF feature is like 10%, but isolated VSD, just VSD, nothing else present in the child, is 40 to 45% of the congenital heart disease cases. Okay, so you can note that down.